Director, Dr. Michael Coombs, will now come and make a presentation on chronic disease violence prevention. Dr. Coombs.
Thank you very much, Her Worship the Mayor, Councillor Brenda Ramsey, Board Chair, Mr. Michael Stewart, Regional Director, Michael Bent, Councillor Olifante, Mr. Chairman, other distinguished ladies and gentlemen. It's really very happy to see all of you joining us here this afternoon for what we hope will be the beginning of a very productive relationships. I'll start by stressing the point that healthcare throughout the world is shifting from what we call a disease-centric approach, where we focus on just treating diseases, to actually promoting health. Right across the globe, that is now recognized as the better approach in terms of cost effectiveness. And that is what you see playing out here this afternoon. And as you've heard explained before, the rationale behind having these town hall meetings, they're not new, they're happening quite a number of countries across the world, and they're very effective, is to really strengthen the links or the dialogue between those who receive our healthcare services and, of course, those of us who provide the service, so we can have a greater degree of transparency, accountability, and we can discuss the issues. And I'm sure that will all go well for the health of all of us. So this afternoon, I'm going to share with you briefly a presentation that focuses on a couple of our priorities in the Ministry of Health that relates to the chronic diseases and, of course, violence prevention, perhaps one or two other things. So I'll just quickly share with you some slides. All right. Now, the non-communicable diseases. I'm sure most of you would have heard the term. And these are diseases, as the name suggests, that they're not really passed on through they're not communicable diseases, they're not passed on, they're not microorganisms that people acquire through the infectious process. These are chronic diseases that are like listed there, those related to the cardiovascular system, diabetes, chronic respiratory disease, and certain cancers. So they are not communicated as the communicable diseases are, they're not passed on, rather. And so what we've had over the decades is that in previous decades, not very, very long ago, most of our diseases that contributed to death and disease were really those of an infectious nature that took lives and caused disease. We've transitioned to a state where the non-communicable diseases that I just mentioned are now the major contributors, as I'll show you, to death and disease. And as you've heard before, all of these non-communicable diseases, they have in common the fact that they're caused predominantly by smoking, poor diet, physical inactivity, and the harmful use of alcohol. Now, just to give you a little grasp of the magnitude of the problem that we're dealing with, it is estimated that there are 36 million deaths worldwide annually caused by the non-communicable diseases, 63% of all deaths. And that really is comparable to the total population of all Caribbean countries. And 80% of all of these deaths occur in low and middle income countries. And they kill at a younger age in low and middle income countries when compared to the developed countries. And 29% of the deaths are in people who are under the age of 60. It's the leading cause of death in the Caribbean, and at a younger age in the Caribbean compared to the rest of the world and the rest of Latin America, rather. All right, so looking briefly at the cost of chronic diseases in Jamaica. I don't have very recent figures, but this was estimated in 2002. So you can do your estimates in terms of what it will be now. But at that time, it was estimated that the chronic diseases annual cost is $1.75 billion. And you see the hospital-based costs there and so on. So clearly, in terms of cost to the state, to the nation, the chronic diseases really are of significant concern. All right, in terms of the four major NCDs, the cancers, the diabetes, disease of the circulatory system, and the chronic lower respiratory diseases, you can see the breakdown here in terms of their contribution to deaths in 2010. And you have the figures right there. The diseases of the circulatory system are leading at 33%, diabetes 30%, cancers 21%. And others, you see there, the chronic lower respiratory diseases. And note that 70% of the deaths are due to the four major NCDs, and 24% occur below the age of 70 years, something to really take note of. What this slide shows very quickly is that there are what we call modifiable risk factors where the non-communicable diseases are concerned. And this is very important to understand, and I'll get back to this very shortly. But in terms of these risk factors that we mentioned, the tobacco use, unhealthy diets, physical inactivity, and the harmful use of alcohol, these are things that it is found from research. If we can tackle them effectively, they go a far way in preventing the NCDs and lowering your risk of having any of the non-communicable diseases. And there were some studies that were done in 2000 and 2008, the Jamaica Healthy Lifestyle Survey. And I'm showing you this because it shows a very worrying trend that we need to take note of. And that is when it comes to physical inactivity, if you look, let me see. Right, if you look right here, are you seeing it? Yes. When you compare the results in the year 2000 of this survey, and you compare it to the survey of 2008, the findings in 2008, you can see that we've almost doubled in terms of the number of persons who are physically inactive. And this is not good. We're becoming more and more inactive. Anecdotally, we have noticed that persons have taken to this physical activity routine, and we're happy for that, but we still have some way to go. And then look at obesity. This is related to nutrition again and physical activity, overweight and obesity, but especially obesity. We have moved from 19.7% of those surveyed in the year 2000 to 25.3% in the year 2008. And this is clearly a significant increase. And this is something that we have to deal with. I'll get back to this, but Jamaica has a problem with overweight and obesity, and we have to do something about it. And in fact, my next slide underscores that point, that there are 4 English-speaking Caribbean countries, including Jamaica, that are among the 15 countries with the highest rates of overweight and obesity in the world. Some people say it's part of our culture, the men like their women fat. I don't think that's the entire story, but this is of much concern. We do not want to be a world leader when it comes to overweight and obesity. And in fact, according to some World Health Organization statistics recently, it is estimated for certain age groups as much as 80% of our adults are overweight and obese combined. And that is not good when it comes to the non-communicable diseases. So we want to underscore the point, ladies and gentlemen. This is what we have been stressing: prevention. Prevention. You know, I just showed in a previous slide that it's very expensive to treat these non-communicable diseases when you have them and you end up in our hospitals with all the complications, whether they're cardiovascular accidents, other heart problems and so on, the cancers, you name it. They are very costly, extremely costly. Now, therefore, that makes it even more important for us to consider the fact that where these modifiable risk factors are concerned that we mentioned about physical activity, alcohol use, tobacco use, and proper nutrition, that because of the cost of treating the end result, then we have to pay a lot of attention to these risk factors that significantly reduce the chances of persons coming down with these non-communicable diseases. And when you look at it, what is the cost? What is the cost to an individual to really practice in a consistent way physical activity and exercise? The experts tell you that if you exercise for at least 20 minutes to half an hour each day in a way that increases your heart rate, your respiration, not just talking a little stroll, that will not do much. At least 5 days, or better yet, every day, that goes a far way in reducing your chance to getting these non-communicable diseases. So, it is obviously much more affordable to deal with these risk factors, to have them addressed in our population, rather than dealing with the disease themselves. And so this is something that we are really very, very intent on doing. We have to provide the right environment, and we have here this afternoon Dr. Clifton Reed, who, after I speak, will tell you about Brooks Park, that initiative that we have here in Manchester, in Mandeville, which perhaps I was saying to him is a best practice. And you'll hear more about that when he speaks. But the fact is, we have to provide the environments that facilitate physical activity, and not just physical activity, but social interaction. That too is health-giving, just allowing persons to interact socially. And I should have mentioned that the cost of the NCDs is not just financial, but there's some significant social costs to families. When somebody suffers with a stroke, you name it, have come down with cancer, that social impact, the cost there is quite significant. And so we want to provide environments that facilitate physical activity. We want to educate our public about proper nutrition, and this cannot be overstated. And in fact, the WHO passed a resolution some years ago at the World Health Assembly, that if a resolution had recognized the fact that if as a nation we can deal effectively with physical inactivity, and proper nutrition would have gone a far way in tackling the problem of the non-communicable diseases. And of course, tobacco use. You are all aware that the Ministry of Health under the Honorable Minister, last year, 2013, led the charge in passing the public health no tobacco legislation in 2013. And that is obviously aimed at the prevention of chronic diseases, especially certain cancers that have been established to be linked to the use of tobacco. Similarly, alcohol. We have to get on top of the abuse of alcohol at all ages, because that has been linked to a lot of chronic diseases, including the cancers. Okay, so we can't stress that too much. Just to let you know that we have the cabinet recently approved a non-communicable disease strategic plan, and that is in the context of all that I've shared just now. We have this strategic plan covering the period 2013 to 2018, aimed at controlling the non-communicable diseases. And it has all the components that you'd expect of a strategic plan of this nature, from prevention, how do we prevent, which is what we're talking about this afternoon, from prevention through health promotion to treatment and rehabilitation. But we want to zero in on the prevention and health promotion part of this strategic plan that spans the years 2013 to 18. Just like to quickly move on to violence prevention, and to say that something that we all know, that violence is a major health problem. And did you know that 90% of violent injuries can be prevented? To give you an idea of the impact of violence, this is a slide that looks at the cost of injuries, the admissions for the various causes to our hospitals. I think this is in 2003. And you can see there that at the top in the red bar, that injuries are by far the most costly, over $1 billion for that year. And a lot of these injuries are intentional injuries or related to violence. And so this is something that we cannot afford to ignore. 2003, I was correct. All right, now in terms of how we deal with the violence issue, you would have heard, some of you I'm sure, in different settings, that we take the public health approach to deal with violence. In fact, we take the public health approach and deal with anything, any health challenge. And it includes how we deal with violence. And in fact, Honorable Minister Peter Bunting in the Unite for Change, you would have heard that that is the approach that is being taken in terms of violence prevention. And what that really means is that we identify, in dealing with the issue of violence, we identify what are the risk factors, what are the things that contribute to violence, what are the things that are protective, what are the things that, you know, when they're experienced, they actually reduce the risk of persons experiencing violence. So that's the public health approach. And then we look at the persons that are involved. We look at ways of breaking the transmission and the occurrence and so on. And just to quickly show you in this slide that of a cohort of Jamaican children that, that were examined, 11-year-olds in fact, that these are some factors that came into play. Look at them. And you'll hear us talking in the southern region, at least as long as I'm there, about the family. And the fact is that the family is now being recognized and established from research to be a root or foundational cause, the breakdown that is, to a lot of the problems that we face throughout the society, not just in health, but in other social issues. But violence is a big one. And if you look at this slide, it was found from this study of these children, 11-year-olds, that those that were separated from mother, 18% of them experienced that violence in their lives. But look at father. Those that had a separation from father, 51% of those who experienced violence, they had that in common. And this is something that we have to sit up and look at if we're going to tackle this problem of violence. What do we do about this fact that when father is not there, that there is a greater predisposition to violence and to become perpetrators or victims of violence? It was found that children who attend church, they were less aggressive in their behaviors, so you might want to consider that. And again, stable family units with expressions of warmth and care had a positive effect from Professor Sams Vaughan and Dr. Maria Jackson. And just to say, as I try and wrap up quite quickly, is that another chart that shows the age group by gender where violence-related injuries are concerned in 2003 in 9 Jamaican hospitals, and you see the breakdown there. And take a note that our males are more violent, generally speaking, from the blue bars compared to the pink. And you see the common age group there, the young adults. Again, something that we need to bear in mind when we try to tackle. And so, in terms of violence prevention activities, we must consider risk and protective factors, as I said. From what I've showed you, and there's a lot more I could, but time would not allow, we have to look at strengthening family life. That is becoming abundantly clear, that we have to, as a nation, we can't no longer afford to pay lip service to the fact that, well, we have all kinds of families and it's just so the men are socialized, they come from Africa and they are accustomed to having a lot of women and that sort of thing. We are going to now have to face the facts that research has confirmed that when fathers are not involved in their families and the family breaks down, that those children especially are up to 11 times more likely to demonstrate violent behavior. Not my opinion, this is the findings from research. So we have a recently formed National Association for the Family, National Parenting Support Commission. All of these will have to get together to strengthen the family life with the other NGOs and other state entities. And as I said, the issue of fatherlessness. I've become so accustomed to these statistics. I can tell you that over 90% of the young people in our prisons that are incarcerated are from homes where fathers are not there, fatherless homes. I can tell you that, as I said a while ago, 11 times more prone to violent behavior when father is not there. Daughters who do not have their fathers, from some research that has been done, are 9 times more at risk of being sexually abused and raped because father is not there. The majority of the unattached youth that we see wiping our windscreens and that are on the streets are from homes where no fathers are involved. And so if we as a nation were to tackle this problem of even violence, we're going to have to look at that. And so the Unite for Change initiative factors that in. Our Honourable Minister Bunting has that in the third component of the Unite for Change. And there's a Manchester initiative too, where violence prevention is concerned. And so, in closing, just to say, I'm just giving you some things to think about and to spark some discussions, if you will. In going forward, what we're saying here this afternoon in this town hall meeting as a Southern Regional Health Authority is that we need to promote individual empowerment and responsibility for our health. No longer can persons rely on the state for provide. We have to do that. The government has a responsibility to provide hospitals and centers. That will not be sufficient. What we need to do, and this has been recognized for many years now, we must empower persons by educating them and let them know that they are responsible primarily for their own health. We have to encourage the all of government. It's no longer just the Ministry of Health when it comes to the chronic diseases. We have to partner with Ministry of Agriculture, Education Ministry, because the chronic disease is going to take the all of government or joined up government approach, the all of society approach. All of us will have to get involved. We have to facilitate physical activity, as I said, and social interaction. Here from Dr. Reed. We have to look at workplace policies that facilitate physical activity. That is in the interest of productivity when we have healthy workers. We're going to have to look at that. We have to revisit we had an initiative in Mandeville called the Park and Walk, for health, where we said, okay, can we have a part of our town that is zoned off? And we say, okay, especially for that time of the year when the weather will allow, that we say during that time, no cars are allowed in this year. It happens in other countries like Brazil, London. You cordon off a place and you walk. You walk and you exercise. You get exercise in the process. So in collaboration with our police and others, we need to look at things like this. We need to look at promoting healthy lifestyles like healthy eating from early childhood, going back to the family and parenting. You see those habits that we all have about what we eat and how much we exercise? Where do you think we got the ideas from? Where do we think we got those habits from? They're from when we were like this in the formative years and we observed our parents not doing them or doing the wrong thing. It has been found again from research, it is not enough to tell your child what to do. You must practice it in front of them, including what you eat and what you don't eat, and how much you exercise, and the fact that you do not smoke. Some of us would love to follow our fathers when we were young. We see them smoking, we want to smoke. We smoke newspaper and all kinds of things. We need to promote healthy lifestyles from we're young. We need to look at fatherhood and male development in terms of the impact of that. And that is a big issue, I am convinced, in our nation. We need to socialize, look at the socialization of our males, especially in terms of their identities and in terms of them becoming the fathers that recognize the importance of when, in fact, they become fathers, that they have a critical role to play in the lives of their children, where health is concerned and other things. We need to enforce the tobacco regulations, monitor the use of alcohol, talked about family enough. We need to keep health and health promotion on the agenda at all gatherings. And I'm saying to all of us here, whenever we have a gathering, wherever we have a gathering, keep health on the agenda. Our health department is only too willing to provide material if you're having your PTA, if you're having your council meeting, whatever, wherever you're meeting, wherever there's a gathering of individuals, get into the habit of putting health on the agenda. It is extremely important that we do this to spread the message. As I said, the health department will support you in this. In fact, we have brochures behind on nutrition, physical activity. Feel free to help yourself. This was a Park and Walk for Health thing that I talked about. Thank you very much, ladies and gentlemen.
Wow. And thank you very much, Dr. Coombs. That was quite a mouthful. Is that so, people? Yes. That was really, in my mind, very, very rich. Very good, Dr. Coombs. Over 20 years ago, Dr. Coombs, I made an intentional and deliberate decision that my children, even before I start, will see me at every stage of the game. Anytime they call on me, I will be there for them. And I can attest to the fact as to what you have said, it made a difference. It made a difference. I want to ask a very deliberate question now. In 2002, according to Dr. Coombs' presentation, $1.75 billion, is that correct now, was spent as a result of non-communicable disease. Deliberate question, Mr. Bent. Mercy. And I'm going to keep it constant. I'm going to keep it constant at $1.75 billion. And I pose the question to the mayor. No. You're the mayor of Mandeville. If you have $1.75 billion to work for Mandeville now, what difference would that make? It would make a significant difference. And I am sure if my good friend Alwyn, Mr. Miller, has that amount, 989 million, you said, Doc, that was spent in hospital care, secondary care, to work from Mandeville Hospital. Wow, I see Alwyn shaking there. It would make a significant difference. And all Dr. Coombs is pointing out is that we just need to change our lifestyle. The risk factors, cut out smoking, cut out alcohol, proper diet, and it makes no sense to practice these if we are not exercising. Right, Dr. Coombs? So we need to get on the beat, get up in the morning, breathe some fresh air, walk 2 or 3 miles, 45 minutes, get back home, have your shower and get to work. You will move the work the day. When people get angry at you, you will be more calm in handling situations. I am not going to take away from Dr. Reed's presentation, but I know it's something that works. And if we only take the time to make the difference, take the time to take care of ourselves, what a difference. Jamaica need $1.75 billion now to do some work. Southern region, the health services, the police force, you name it. We all, the schools, and what a difference that would make. My oh my, I'm not here to talk away though, but Doc, I enjoy the presentation. I really enjoy. 36 million persons died every year. That's a lot of people. Isn't that so? Wow. Dr. Reed, please, sir, come forward before I go on.
Mr. Master of Ceremonies, Mr. Joseph Grant, Her Worship the Mayor, Councillor Brenda Ramsey, Councillor Oliphant, representing the Minister of National Security, Mr. Michael Stewart, and his senior officers of the Southern Regional Health Authority, other dignitaries in the audience, friends, ladies and gentlemen. First, let me thank the Southern Regional Health Authority and the organizers of this very timely town hall meeting. And for the topic, Let's Talk Health, for inviting, first of all, the Bookspark board to make a presentation. And I also want to thank you on behalf of our parent. Let me get this right, it is an amalgamation. Our parent is the Community, Civic and External Affairs and Brooks Park Committee. This is a committee of the Manchester Parish Council. Did I get it right, Mayor? For this opportunity to participate, I'd like to start by saying that from my perspective, exercise is the cheapest and most complete medicine. It touches every part of the biopsychosocial model for health. That is the bio, the physical, and all of us have heard about the direct impact on diabetes, hypertension, and so on. What is also known, but not as well known, is the impact of exercise, parks, nature on the social and the psychological aspect of health. And so I'm really very happy to be here, and I'd like to invite you all to come to Brooks Park and take up your free doses of medicine. It is what is driving us, this importance of exercise. This is what is driving us at Brooks Park, to make sure we provide for you a modern place for you to come in the evenings or afternoons or daytime or whenever time you have the time, and just allow the stress to ooze off. So I want to start my presentation by just telling you what is there at Brooks Park at the moment, or what we have in mind. Presently, if you go to the park, most of you are accustomed to that football area. And most people think Brooks Park is that small space. We have to tell you that Brooks Park spans some 38 acres of property, that it's borders Winch Road all the way onto Ward Avenue, so that the horticultural showground is actually part of this structure. 38 acres of property. And we intend, along with the cooperation of the Horticultural Society, the Lions Club, at least a part of it, the school, and so on, we intend to develop this as one holistic place for recreation and relaxation. So, presently, there is that immediate area that come next Sunday, I hope you'll all be there supporting the Lions Club in their major fundraiser, the so-called Men Who Cook. And we are looking more men to cook, so if you have that special culinary skills, please see me afterwards. Right now, when we embarked on this really mammoth journey, it became very evident that the resources were not available to take on this thing in its entirety. And so we tried to transform that small football area into something of a complete park. So there is a kiddies area, there's a fields, there you can have athletic pursuits. We are currently, as we speak, completing a clubhouse that is supposed to be a tourist rest stop. We hope to engage kids, particularly in the summer, in basic life skills, some of the things you mentioned. That is going to be a multi-purpose place, and we hope to have regular activities on a week, during weekdays and weekends. Some of you may have heard about our famous night cricket, and more recent night football. As we speak, we have sent off a document to the Tourism Enhancement Fund to assist us with creating a grinder entrance, to put in a paved parking area, to get internal boundary surveys done, we intend to erect something, what we're calling a heritage dome, that is to capture some of this very rich history. I mean, when you look at the Manchester, it has the distinction of being born. 1814, the 13th of December, something like that. And so this year we are, the bicentennial year, 200 years old, in fact. But when you look at this parish, the history is tremendous. And we are seeking to capture this in this civic center. But there is supposed to be, as well, a botanical garden, and we're working with the Horticultural Society to develop this. Manchester is known for its flora, but yet there is no formal botanical garden. This is something we're seeking to do. There is going to be a civic center that we hope will be the home of many different sports, including, we'd like to bring bowling to this island and to this part of the parish, part of Jamaica. But beyond that, and the Olympic science swimming pool, is the people in Manchester live far from the sea and therefore can't swim. We will make this available to each and every one to learn to swim and so on. Those are some of the things that are planned. But I want to mention the Peace Monument. Those of you who are aware would know that last year in about November, we had a gentleman by the name of Louis D'Amour, who is the founder of the International Institute for Peace through Tourism. And he came to Mandeville and he established Mandeville as the first peace town in the Caribbean, and Brooks Park as the first peace park in the Caribbean. We dialogued and we convinced him that we intend to take this whole peace movement and peace movement forward. As out of that, we've built a peace monument. It is still in the finishing stages. What we're hoping is that people who are pursuing anything to do with peace, and we've heard some mention, spoke directly about peace and so on, anything to do with peace, would use this monument as a rallying point. Come there, use it in whichever way you feel. The words, I'm sorry I don't have the words here with me, the words of a plaque that will be affixed to this monument. Suffice to say, one of the lines read thus: the Brooks Park Board and the Parish Council dedicate this plaque in the furtherance of the outbreak of peace in Manchester. Interesting. So the other thing that we've done is that we've just submitted recently to the Digital Foundation a plan that we call a peace competition, where we are seeking to engage young people in the parish. You would love to hear this. Kindergarten, high school, primary school, in this whole business of thinking about peace and putting that down in poems or in any format, in art, of your choice. The idea is, what we feel is that if you go through the thinking process, if you process peace to the extent that you are going to put it in poetry or in the art form, then something must rub off. In a matter of 5, 10, 20 years down the road, we intend to see a more peaceful Manchester. But that grand plan that we have for Brooks Park, and this is not just unique to Brooks Park, but any parks and green space, it will be a game changer on the economy of this parish. We recently took a decision to convert one of the parking areas to add to that a hostel that will sleep about 60 persons. And what we intend is for persons from North America, England, wherever, when it gets hot or very cold, like we've experienced climates recently, teams will come here and stay at Brooks Park, use the facilities, and we'll earn some money. Sports tourism. So the land values will improve, the image of the town will improve, tourism, employment and training, economic development, and so on, in terms of the economics of it. People and community, if you get people together in the same space interacting, your demeanor, your relation to persons much improve. And so we seek to engage communities to come to Brooks Park and use it, games, etc. So the community will benefit. It will benefit the environment. But what I really want to speak in the next few minutes I have is more the health benefit of Brooks Park and parks in general. And I'm going to focus specifically on the mental and well-being, health and well-being. Because we know the physical. I mean, you've heard it over and over. Exercise improves the hypertension, the blood pressure, and so on and so forth. Do you know that if you expose someone to nature for 20, 30 minutes, that is to say you do bird watching, you listen to the river, the stream, you enjoy a good, beautiful scenery, colors, nature's magic in front of you, that in just 20 to 30 minutes of that, you can actually measure a fall in your blood pressure, a fall in your pulse, a fall in the tension in your muscles, an improvement in your asthma. These things are not enough appreciated by many of us. And that's one of the reasons why we don't have more of these things. There was a forum in Mandeville recently where business leaders came. I think it was MAG or something, came to Mandeville. Spoke a lot about the importance of the economic growth, small business, whatnot. Wonderful presentation, I enjoyed it. And I tried to engage the leader at the time of the importance of, at the same time, invest in green space for the very employees that you expect to drive this growth. I managed to get the question in, but I was sidelined very quickly by somebody who had more important things to discuss. We don't appreciate the benefit of space, green space, and those countries that do. Every few miles you go, there's a park. You made the point about inactivity increasing, obesity increasing. Parks, such as Brooks Parks, can have a significant impact on that. And I know we may be speaking to the converted. People who are here tend to be the ones who are in the know. We obviously need to reach the persons who are not here. And before I close, I really again want to thank the Southern Regional Health Authority for the initiative to restart this town hall meetings, because I believe that people need to be informed. And I would just suggest, though, that unfortunately, if you really want to attract persons to your meeting, find some controversial health topic and throw it out there that we'll be discussing it. And you might find it inside your full. And then once you have this captive audience, we can do the other things. Thank you very much again for the invitation. If there are any questions, I'd love to be able to answer them.
Very powerful again. Thank you very much, Dr. Reed. Thank you very much. I just take a moment to recognize the presence of our media. And I'm sure we will see some very exciting report in one or two of the different media houses. And also to take a moment to recognize the presence of Northern Caribbean University joining us with Dr. Milford and wife. Right. All right, good to have you. All right, Dr. Milford and come back. Sorry, I'm looking at Dr. Milford in my mind because we were having an active discussion the other day, Dr. Gardner, and his wife. All right, Dr. Reed, you wish to say something?
One of the things one of the challenges we have is finding resources to maintain this green space of which we speak. And I want to alert you that very soon we'll be launching this Friends of Brooks Park program, where we'll be giving you a barcoded picture ID that will afford you discounts in many businesses that support the park.
Interesting.
But also it will allow you to rent the park. Mayor's not listening, so I can speak. At a reduced cost. So please, we hope very soon to launch this. The other thing is just to say to you that come this Labor Day, we hope to engage in a massive cleanup and beautification project at the park. So I invite you to be part of us at come Labor Day.
All right, again, we appreciate Dr. Reed's presentation, and just note the emphasis on exercise, the emphasis on taking care of yourself. Mr. Bent, after the stress of work these days, you know what I do sometimes? I buy a fishing rod and go to the beach, dog. Just catch some fish and let them go. Harass the fish and let them go. But I just feel the stress of the day just let go like that. Mr. Charlton McFarlane is not here. He was to present on the GOJL card. Nonetheless, we would just love you to know that at the very back of the room, there are some registration form, and you may register yourself. In as much, Dr. Gardner, I would love for the entire staff of Northern Caribbean University to register. And we have enough form that we can register all members of staff. Doesn't matter whether they're teachers, ancillary, whoever resource person in the audience, we can take your concerns just about now. Makes no sense we keep talking to you and you have no concerns, right, Doc? There must be concerns in the audience. Who will be the first?
While they formulate the question, I can probably. While you think of your questions, I'd like to state that one of the concerns that existed some years ago was that prevented more persons from using the park for recreation, for security. I'd like to state that Metro Dade Security, as of a few months ago, has donated to this park, or to this parish, a security person from 6 in the morning to 6 in the evening, free of cost. So we have a security guard on spot, and I would like to, because from time to time I get it from my patients, as I constantly beat this hobby horse about walking. They'll tell you that they're being mocked and there are things that, oh, we know these things are happening. But it is safe to drive to the park and go around. It is safer and healthier to walk on a grass surface than it is from walking on the hard road. So you can drive to the park, park your vehicle and walk around in safety.
All right, who will be the first to hear your concern? We have about 10 minutes or 5 minutes to pose some questions. Councillor.
Thank you. The figures, monetary figures are really frightening.
Yes.
And I think that we should adopt a plan, an insurance, a health plan for our people. I believe that from the very first paycheck that you get at 18, something should be put aside for health purposes.
I have a question for my colleague. In other jurisdictions, insurance companies will promote health, sickness prevention or health wellness endeavors. What we in China did call it well-baby clinics, for instance. Our insurance companies don't do that. Is there a way in which the government can engage them so that they recognize things like if provide some incentives for persons to go out and exercise or do these other things that you're saying they should do in order to maintain health? It's a kind of short-sighted approach to things, but I know in other jurisdictions they do that. They will recognize wellness activities.
That's an excellent point, and we need a paradigm shift. As I said, the world is now moving from a disease-centric approach to healthcare to one where we promote health and prevent illnesses. I think it's just for obvious reasons, it's a tough sell to insurance companies and so on. We've actually tried and we've made the case, and I think the authorities just simply need to continue the advocacy because it is an international trend, and we talk about the social determinants of health, as I think I mentioned earlier. And you're absolutely correct, it happens elsewhere. I'm not sure if it's been officially established here, but we need to continue the advocacy because it's obviously the most cost-effective way to be healthy, to promote, give incentives. Say to persons, look, okay, if we have evidence or you develop some indicators that you can monitor, you can sort of, see what people are doing. In fact, I think Northern Caribbean University recently launched, and I was a part of this, their 10,000 Steps initiative, Dr. Gardner, and you actually have the pedometers that I'm giving you a promotion now.
Go ahead, no problem with that.
You have your pedometers that monitor the steps that persons take, and you can assess that afterwards. We need to go in that direction, and we need to, as I said, develop incentives.
All right, Doc, I have a youngster here that is burning to ask a question. Go ahead, Fred.
Let me stop talking.
Good afternoon.
Good afternoon.
My sister and I really want you to know how you get the children in the exercise, because a lot of these days technologies really hinders the child from actually getting up and going outside to do something.
What a good question.
The question, Dr. Gould.
I should probably ask some parents to answer that question. Mrs. Ishmael, would you like to hazard a...
Good evening, all. I just say that family, and I think as parents, we set an example. We can exercise with our children, we can walk with them, we can ride with them, we can play outside. Just want to let them know that there's more to life than just staying by the computer.
Absolutely, so you're part of the right.
Question over here.
Right, I just like to add to that response. Parents have to change their own mindset because it's easy to allows the parents to go and do the things that they think are important. So parents need to change their mindset, help the children to set appropriate limits and boundaries. The television is on 24 hours, but it doesn't mean that the child has to wake up and go and sit in front of the television. So instilling routines and certain level of boundaries and discipline there.
Just a comment on that. It's a critical question, my brother, because Einstein predicted, if we allow this technology to take root, completely control of our lives, what is going to happen is that we're going to have a generation of persons who don't know how to socialize. Because they take these things everywhere they go. They're into this thing. So they talk with your neighbors and talk with your friend next door, is a dying art.
Another question over here.
Yes, good evening, everyone. I'm Sonia Brown. I host the program on Best 100 FM, Spotlight on Central Jamaica. So it is really a privilege and it is really a blessing to have this forum, something that I will be able to probably report on at a later date. But my concern here is the promotion of the Georgia health card, which I applaud. I hail this. It's a very, very good move, very, very good thing. Not many persons knew that even the NHS and the other ones were in existence. Now, this seems to be a new thing. My question is, however, are there provisions being made in the health facilities to accommodate? Because I'm seeing a number of persons, having access to these cards heading into the health facilities. I have had the privilege of going, well, it's not a privilege really, I've had to be going to visit my sister in the Mandeville hospital who has an amputation, and she's been there for the past 2 months and so on. And the hospital is overflowing already. I've been to the health center and it's also overflowing. Now with the new cards, are we making any sort of provision? Are there any provisions being made to accommodate staffing for one, and to be accommodating the number of persons who are going to be coming in for health care?
Over time, the provisions have been made. Over time, in the next 18 months, all things should be covered there according to the plans of the government. So gradually, as the registration process goes on, persons and take on new dimension, the provisions will be in place for them. All right?
Just wanted to add to that, Mr. Grant.
Yes, sir.
That currently facilities are equipped to accept the surgical cards. So we have all the necessary technology. So you go to the hospitals, family hospitals, and you present your card to the persons, the staff members, the cashiers, right? And it will be swept. So currently there are facilities in the hospitals. But as Mr. Grant explained, that with the introduction of the GOJ health card, that will be expanded over the next 18 months. In terms of accommodating. Yeah. Well, staffing is also being looked at as well, but I think that with the technology, the number of staff will be diminished. So in terms of for use of that.
And to a great degree, it's more technology-based, Dr. Gardner.
Good evening. I am Patricia Gardner. I'm the staff physician at Northern Caribbean University. And I just wanted to tell individuals here a little bit about what we are doing at Northern Caribbean University. And maybe it would stimulate you to do something similar in your organization. We have approximately 300 employees that have enrolled in a program we have called the 10,000 Steps in 10 Weeks program. Through linking with Guardian Life Insurance, we have provided pedometers to these employees, and what we have done is to encourage them daily to walk, increasing their steps every day to a total of 10,000 steps in 10 weeks. It's very exciting.